For your health this morning, research shows Americans have 1/3 more fatal heart attacks during the holiday season than any other time of the year. To explain why and to help prevent that from happening, it's what's known as the Christmas coronary and Happy New Year heart attack phenomenon. Our health expert Karen Owak joining us live here with a little bit more detail. Karen, thank you so much for joining us to talk to us about this. I think it is a really important topic because the holidays already come with so much stress, but is stress the only reason that we're seeing these heart attacks?
Well, lots of reasons, and the critical period are these the top 3 days actually are Christmas Day, where we see the most cardiac deaths, and then the day after Christmas, and then New Year's Eve. No, New Year's Eve, New Year's Day, but those are the top 3 days to keep in mind. But stress, you know, we talked about this last week, and Noel, how stressed we are during the holidays. And what happens when you're stressed is that cortisol, that your stress hormone, goes up. And then when that goes up, it affects your heart rate, increases your heart rate, and also affects the stickiness of those platelets, the things that cause the blood cells that cause blood clots. So what happens is when you have high levels of cortisol, you are 5 times more likely to die from a heart attack. So we got to keep those stress levels down.
So definitely reduce your stress. Your next tip is not to skip any medications you might be on.
Yeah, a lot of people get so caught up in what's going on and with the holidays and traveling and kind of forget to take their medication or forget to refill it or just forget to take it with them on a trip.
Okay, so
So
definitely
can't forget that.
Yeah, be sure to pack those. If you are going on a trip headed up to the snow or something like that, that can actually be a trigger for a heart attack as well. Cold temperatures.
Yes, the cold temperatures. Cold is really hard on the body and on the heart. It's just because that when it's cold, your vessels constrict, they tighten. And so it's harder to get blood flow and your heart has to work harder. You're not getting as much oxygen. So just stay warm, dress in layers, just be cognizant of the cold.
And doing activities like shoveling snow. Maybe you have a house up in Tahoe or something and it's going to get a little bit more snow this week. You're saying skip the shoveling.
Yeah, this goes hand in hand with the cold weather. Shoveling snow and dirt. I mean, those things are heavy, and people forget that. It's very exertional. So you have to really be careful, especially if you're a smoker or have any history of heart disease. You have to be mindful. In fact, one of my patients told me the other day that he lived up in the snow area, and the county put out an alert, no snow shoveling, because their ICUs were full.
Oh, wow, because those types of an accident or perhaps a heart attack, something like that could happen. I think that it's hard to say don't overeat because it is the holidays. You're going to be around a lot of people, but that is a very serious point you're making. Do not overeat, overdrink, or oversalt your food.
Yes, all those things affect the lining of your arteries. And so you really have to be, you know, it's hard. I know it's hard not to overindulge. I mean, that's what the holidays seem to be synonymous with, but really be mindful. They actually have a 2-hour hazard period where when you overeat, the 2 hours after overeating is when you're at higher risk of having a heart attack. So keep that in mind.
And usually after that overeating or while you're eating, something probably tells you, maybe I should stop, but then sometimes you keep going, and you're saying you got to listen to your body.
Listen to your body. Listen to your body when it comes to how full and how satisfied you are, as well as all those signs and symptoms. A lot of those symptoms of a heart attack, you know, the heartburn, shortness of breath, people also correlate that with just overeating. But think about, so really I can't emphasize this enough, is listen to your body, and especially when you're doing things a little out of the ordinary, things out of your routine.
I know you just mentioned those symptoms, the, you know, chest pain and you know, kind of your left arm. Is that the same for men and women? I've heard that women have different signs for heart attack.
Men and women do have different signs. Women have more subtle signs of a heart attack, and that's why there's so many women that don't survive their heart attacks, or they come in too late. A lot of times they complain of back pain, and they correlate that with just overexerting themselves. And a lot of the times women have symptoms that come on a month before their heart attack. Difficulty sleeping, indigestion. Oftentimes people think, oh, I just have the flu or coming down with something. So yeah, women don't always have that crushing chest pain or that radiating pain down the arm. So really listen to all those symptoms, and sometimes they're a little more subtle, but really listen.
I know we have just a couple more here, but a big one I know for sure is getting your flu shot. That's really important before heading home for the holidays.
Right, because getting your flu shot is real important, because when you get the flu or any kind of illness like that, your body inflames, and that could rupture the hard plaque that's in your arteries, and then that could cause a clot. So very important, get your flu shot and just try to stay as healthy as you can.
And finally, carry around some non-coated aspirin. That's really helpful for folks.
Right, that's an antiplatelet, so that helps to stop the clot formation. Okay. So, and I have more of that on my website, so how to take the aspirin properly.
I know you've got a lot of tips on your website. We really appreciate everything that you do for us, especially when it comes to the holidays and keeping us healthy. Thank you so much for joining us this morning, Karen.
Bye-bye.
We'll be right back.